Imagine this. You're a man in your 60s, maybe even 70s. You've worked hard, built a life, and now all you want is to enjoy your years with confidence and strength. But one morning, you wake up and notice something feels different. Your body doesn't respond the way it used to. Erections feel softer, shorter. Maybe they even vanish some days. You start wondering quietly, is this just age? Am I fading away? And yet, deep down, you know the truth. It's not just age. It's the silent decline of systems in your body that can be restored, if only someone showed you how. I'm Dr. Maya Kapoor, and after more than 3 decades as a urologist, I can tell you with certainty, there is a way back. And it's not a quick fix from outside, it's a strength you build from within. It comes from something so simple, it might shock you. 3 minutes a day. Here's what most men never hear. Your confidence, your performance, your vitality, they're not only tied to testosterone. They're deeply connected to the muscles most men forget even exist. The pelvic floor. These quiet, hidden muscles stretch from your pubic bone to your tailbone, acting like a foundation that supports your bladder, your prostate, your bowel, and yes, your erections. When they grow weak, blood flow falters, nerve signals dull, and erections slip away. But when you strengthen them, you unlock circulation, control, and a firmness that makes you feel alive again. Think of it as upgrading the foundation of a house. The walls, the roof, everything above becomes stronger. And let me say this right away. This isn't about magically changing your anatomical size. No exercise can do that. But it is about maximizing what you already have, ensuring your body works at its absolute peak. I've seen men in their 60s, even 70s, look at me with disbelief after just weeks of practicing this routine, telling me, "Doctor, I feel like something woke up again," and that's the point. Your body is not broken. It's waiting for you to re-engage. The routine I'm about to teach you has been studied, tested, and recommended for decades. But sadly, most men never hear about it. It's called the Kegel exercise. Originally introduced for women after childbirth, Kegels are just as powerful for men. They improve bladder control, prostate health, and most importantly, erection strength and staying power. Done correctly, they act like a natural pump for your body. So, how do you find these muscles? It's simpler than you think. Imagine trying to stop your stream of urine midway, or holding in gas when no one's around. The muscles you tighten are your pelvic floor. It should feel like an upward squeeze, a subtle lift deep inside, not a clench of your abs, thighs, or buttocks. Many men make the mistake of tensing the wrong areas, but once you feel that inner lift, you'll know you've found the right ones. And once you've located them, you can do the routine anywhere, sitting, standing, even lying down. Now, here's the power of this method. It only takes 3 minutes a day. 3 steps, each lasting 1 minute. The first is called the slow hold. You gently contract those muscles and hold for 3 to 5 seconds, then relax completely for the same amount of time. This builds endurance, much like holding a weight to strengthen your arms. The second step is the quick flick. Here, you rapidly contract and release the muscles like flipping a light switch. This trains speed and responsiveness, critical for strong erections. And the final step is the endurance hold. You contract and sustain as long as you can without straining, maybe 10 to 15 seconds at first, building longer over time. Then relax completely. Done together, these 3 steps form a routine that builds strength, speed, and stamina right where you need it most. When practiced daily, something remarkable begins to happen. Blood flows more efficiently, nerves fire more responsively, and erections grow firmer, more lasting. Patients often tell me not only do they perform better, but they also feel more sensation, more connection, more pleasure. It's not fantasy, it's physiology. The pelvic floor muscles compress the veins that normally let blood escape from the penis. When strong, they trap the blood inside, creating the kind of rigidity most men thought they had lost forever. That's why this exercise matters so much. It doesn't just improve your erection, it restores your confidence, your intimacy, and your sense of control. And here's what I love most. This is not about a secret pill or a hidden surgery. This is about your body, your strength, your choice. 3 minutes every day, and you begin building the foundation of vitality again. For men who feel they've been fading, this is the first spark that reignites hope. But before you rush to start, let me warn you, many men unknowingly sabotage these exercises by making small but damaging mistakes. And if you don't avoid them, you may not only fail to see results, but could even strain your body in ways that set you back. Let me guide you through the mistakes I see most often, so you can sidestep them and make your efforts truly effective. The first mistake men make is bearing down instead of lifting up. Think of it this way. You're not pushing like during a bowel movement. You're lifting and squeezing inward, almost like pulling a muscle upward inside your body. If you strain downward, you risk putting pressure on the prostate and bladder, which can weaken them over time instead of strengthening them. The second mistake is holding your breath. Some men instinctively tense up, clench, and stop breathing. But your body needs oxygen during the exercise. Breathe naturally, calmly, as if you were in conversation. Holding your breath builds unnecessary abdominal pressure and actually works against your circulation. The third mistake is using the wrong muscles. I've seen countless men tense their abs, thighs, or glutes, thinking they're exercising the pelvic floor. But that's not the target. If you feel your buttocks clench or your stomach tightening, you're missing the mark. The real squeeze is subtle, internal, and isolated. Finally, the fourth mistake, overdoing it. More is not always better. I know some men who, after learning this, tried to do 20 minutes a day, thinking they'd speed up progress. Instead, they wound up with muscle fatigue, soreness, or even pelvic pain. Trust me, consistency is far more powerful than excess. 3 minutes once a day is enough to create lasting change. Now, let's talk about why this works so beautifully. Erections are a complex dance between blood flow, nerve response, and muscular support. When blood rushes into the penis, it fills the spongy tissue, but without strong pelvic muscles, that blood leaks back out too quickly. That's why some men notice their erections fade even during intimacy. A strong pelvic floor acts like a gatekeeper. It compresses the veins, holds the blood in, and allows the erection to stay firm and reliable. In medicine, we call this venous occlusion. In everyday terms, it means your body knows how to lock in your strength, and the benefits extend beyond firmness. Strengthened pelvic muscles improve sensitivity by enhancing nerve response in the region. Men often tell me they feel more sensation during intimacy, more control, even improved climax. For those struggling with premature ejaculation, these exercises can be a game changer, giving back the control they thought was gone. And there's more. A strong pelvic floor also supports bladder function. Have you ever noticed a few drops of urine after you thought you were finished, or the sudden urge to go in the middle of the night? Strengthening these muscles often reduces dribbling, improves control, and helps you sleep more peacefully. That's a victory not just in the bedroom, but in everyday dignity. I remember a patient named Walter, 68 years old. He came to me embarrassed, saying, "Doc, I've lost my edge. I can't stay firm, and I feel like I'm letting my wife down. We started him on this simple 3-minute routine. At first, he doubted it. How can something so simple do anything? But 3 weeks later, he walked back into my office with a grin I'll never forget. "Doctor, it's working. I didn't think it would, but it is. I feel in control again." Walter's story isn't rare. It's the norm for men who commit consistently. Of course, I want to be honest with you. While Kegels are powerful, they're not a magic bullet for every issue. If you have ongoing pain, severe urinary problems, or persistent erectile dysfunction, there may be deeper issues: heart disease, diabetes, nerve damage, or prostate conditions. In those cases, it's critical to consult a doctor. Ignoring these signs or trying to self-treat could be dangerous. But when used as part of a larger approach to health, these exercises can dramatically improve not just performance, but overall well-being. Think of this as an investment. 3 minutes each day is like putting money into a savings account for your future health. Over time, the dividends show up in your confidence, your energy, your relationships. Because let's be clear, this isn't just about sex. It's about walking taller, feeling stronger, sleeping better, and knowing that your body still works for you, not against you. It's about carrying yourself with the quiet assurance that you're still alive, still capable, still vital. And when you combine this exercise with other healthy habits, like eating circulation-friendly foods, managing stress, and sleeping well, you amplify the results even more. Strong muscles, open arteries, balanced hormones, they all work together. It's like tuning an instrument. Each string matters, but when they're all in harmony, the music of your life becomes richer. So here's my challenge to you. Don't just listen and nod. Start today. Even if you feel skeptical, even if you think you're too old, try 3 minutes. Do it in your car before walking into the store. Do it while watching TV at night. Do it in bed before you drift off. No one needs to know, and yet, in a matter of weeks, you might feel like a part of you has returned that you thought was gone forever. But let's go even deeper, because when you understand how this tiny routine connects to blood flow, hormones, and even your emotional health, you'll see why it's far more than just an exercise. It's a key to unlocking vitality at any age. Here's what most men don't realize. Erections aren't just about the penis. They're a window into your overall health. When blood vessels are strong, when nerves are alive, when hormones are balanced, you feel it in every corner of your life. But when circulation weakens, when the pelvic floor grows soft, when stress takes over, it doesn't just affect intimacy. It seeps into your energy, your sleep, your confidence. That's why this 3-minute practice matters. It doesn't just make you harder, it makes you healthier. Think of blood flow as life itself. During arousal, blood rushes in. Strong pelvic muscles act like a gate, trapping it there, creating firmness. That firmness isn't a luxury. It's proof that your vascular system is still responsive. It means your arteries are delivering oxygen, your nerves are firing, your body is alive. And when you strengthen those muscles daily, you're not only improving performance, you're literally protecting your long-term cardiovascular and prostate health. In fact, studies have shown that regular pelvic floor training can improve bladder function, reduce risk of urinary leakage, and even slow prostate-related symptoms. For older men, that's not just about sex. That's about independence, dignity, freedom. I recall one patient, James, 72. He came to me not because of intimacy, but because he was tired of waking 3 times a night to use the bathroom. He started Kegels as a routine, not expecting much. A month later, he said, Doc, I'm sleeping through the night again. And my wife, well, let's just say she's noticed too. That's the beauty of this practice. It touches every part of your life, often in ways you didn't expect. Now, let me remind you of the pitfalls to avoid. Don't bear down, always lift. Don't hold your breath. Stay calm and natural. Don't overtrain. 3 minutes a day is all it takes. And don't get discouraged. Muscles grow stronger quietly beneath the surface. It may take weeks before you notice changes, but when they come, they'll come with a ripple effect. Firmer erections, better control, deeper sleep, renewed confidence. But there's one more layer to this conversation, the emotional ripple. When men reclaim their sexual vitality, everything shifts. You carry yourself differently. You look your partner in the eye with warmth instead of hesitation. You wake up with a spark instead of dread. You feel younger, not because you're chasing youth, but because you're honoring the strength that's still inside you. And your relationships change too. Intimacy becomes natural again. Conversations grow easier. Laughter comes back. I've watched marriages reignite, not because of a prescription, but because a man chose to invest 3 minutes a day into himself. And here's something I want every man to hear. Aging does not mean shrinking into silence. It does not mean surrendering your vitality. It means learning to work with your body differently, more gently, more wisely. This exercise is proof that even in your 60s, 70s, beyond, you can adapt, strengthen, and thrive. You are not too late. You are not too old. You are not done. So where do you begin? Tonight, tomorrow morning, whenever you remember, start. Find those muscles. Lift, hold, relax, flick, release, endure, then let go. 3 minutes, that's it. Do it every day and let your body surprise you. Pair it with real food, good sleep, a walk outside, and you'll feel changes that no pill can ever give. And as we close, let me leave you with this truth. Confidence isn't about chasing perfection. It's about knowing you're still capable, still worthy, still alive. When you strengthen your body in these small, deliberate ways, you don't just improve erections, you restore dignity, energy, and joy. This is Dr. Maya Kapoor. If this message spoke to you, I'd love for you to share your thoughts in the comments. What part of your health are you ready to reclaim? If you found value here, please subscribe so we can keep walking this journey together. And if you know a brother, a friend, a loved one who needs to hear this, share it. You never know how much 3 minutes a day could change a man's life. Stay strong, stay hopeful. Aging doesn't mean fading, it means adapting. And when you adapt wisely, you thrive.